I think the most important thing is your achievement is not like a one-time thing, and I think it's like something that happens slowly throughout your career. And I've realized that you think, no, once I finish this, I'll be this, or once I get this project, or if this gets accepted, then I'll be there. But that's really not what it's about at all. It's just kind of each thing incrementally kind of bringing it closer and closer to the kind of the best version of you, if you will.
Up next, we're joined by a young professional who's making waves in both sports and orthopedic physical therapy. Dr. Cody Ballay is a physical therapist at Duke Health in North Carolina, where he specializes in spine and knee pain. Now, Cody also serves as the co-coordinator for Duke's Orthopedic Manual Physical Therapy Fellowship, and he teaches in Duke's DPT program. He recently completed his own OMPT fellowship training at Duke in August, and today we'll dive into key takeaways from that experience, his insights on navigating the early stages of career in physical therapy, and his first-time experience here at AOMPT. Now, whether you're an early career PT or a seasoned clinician, Cody's story offers valuable lessons on mentorship, growth, and finding your own path in this profession. Don't move. This is Hands On, Hands Off. I explained to people that CSM feels like 18 different circuses at the same time.
Yes.
This is like one circus
exactly
at one time.
Yep.
Cody, welcome to the program, man.
Thanks. Yeah, I appreciate it.
So before we hit record, your first AOMPT.
Yes,
you've
first
done
AOMPT.
You've done CSM.
That's right.
Your first AOMPT.
Yep.
So it being the first real official day, I can't ask you how it's been going because it's not enough. But what are you expecting, or what are you looking forward to, or why did you come here? What are you seeking?
Yeah. No, I think I've heard about AOMPT is it's just such a rich networking experience here, and I've even seen it went to the first timers breakfast this morning, and I'm getting something in line, and I see a guy from Northwestern, and he says, "Hey, do you have anywhere you're sitting?" I say, "No," so go over and sit with him here. I just finished up my fellowship at Duke, and he had previously done a fellowship with Duke, didn't know that, so we could just connection there, and then there's 2 or 3 other folks at the table, and you get to talking, and then, so I've already experienced that, but I've heard the networking is great, and kind of similar to what we were talking about before. Also with CSM, it's such a massive conference, but this seemed like I'm excited for the talks to be a little more focused on the specialty area that we all, are a part of and things like that. So
you just made me think of something, a conference the size of AOMPT, then a conference the size of CSM, 18,000 or whatever it is now, and then the internet, which is vast and limitless. Yes. It's really funny because you could network with anybody on LinkedIn, but there's no real connection, right? You're just another picture as they swipe by.
Right.
Where at a thing like this, it's someone across the table from you at breakfast. So I don't think neither is better nor worse. They're just vastly different in what levels that you get, that you can connect, in different ways that you can connect.
Yep. And it's kind of neat too, like most or all people have gone through fellowship training, so we've all had a similar experience. But at the same time, it could be very different, and it's so neat to connect on that and hear what stage of their career people did things in, and how their program differed from the program that I did and things like that. So,
well, good radio segue. This is your first podcast interview, but good radio segue. You just finished your fellowship training in August, right?
Yep, that's exactly right.
Perfect. At Duke. What were some of the biggest takeaways for you from that experience, and how has it shaped and helped to shape your approach to clinical practice?
I think it's one of those things where you learn things you didn't think you needed to know
as
you go through. You know,
who knew?
So I think 2 big takeaways that kind of come to mind is going through physical therapy school, and I feel like you kind of gain a lot of knowledge about a lot of things. And then, so I did physical therapy school at Ohio State, and then, which you came when I was a student there.
Yeah, we did a live show there.
You did a live show there, yep. I had some drinks at a Hoffer House afterwards, so that was a lot of fun.
Of course. Fun. Also some good pretzels, good German pretzels.
That's right, exactly. And then I actually stayed at Ohio State to do my orthopedic residency there. And I feel like it was similar to PT school, and you gain a ton of knowledge, but about a little bit more specific area in orthopedics. So I feel like through those 2 experiences, you have a lot of knowledge, but where fellowship came in, which maybe I wasn't expecting too much, was developing a framework or like reasoning process around that, and how to use that information to like think about patients well and treat them effectively and more efficiently and things like that. So I think Duke's fellowship really does a good job in kind of honing that reasoning process and providing you a way to think about patients that's helpful. So I think that's kind of the first main takeaway that I had.
Okay.
And then the second one, kind of similarly, like going through PT school and then residency training and then fellowship training, you kind of get maybe halfway through the program and you're like, I don't really know what's next, you know?
Okay.
So I think I had some really good conversations with mentors about what it looks like to just be a lifelong learner, and, you know, take the fellowship training and not have that end in August. But, you know, what does that look like to keep going and keep growing? Because, you know, not a spoiler alert for anyone, but you don't, you know, magically solve everything at the end of fellowship. You're still challenged by different things.
Right.
So it's just thinking about how to put systems in place and different habits and things like that to continue to develop that learning.
Would it, for someone who hasn't gone through residency or fellowship, from how you described it, from PT school, residency, fellowship, would it be fair to say that PT school and maybe residency are more strategy-based and fellowship is more tactical, like how to apply?
Yeah, I think and it probably depends on the program quite a bit.
Sure,
and that's another thing that I learned too, you know. Advice I give to people who are thinking about residencies or fellowships.
Ask lots of questions.
Ask lots of questions. Like, first of all, figure out what you want, you know. So even for manual therapy fellowships specifically, there's programs that probably emphasize like the hands-on component more or less than others. So I think that's valuable kind of depending on what you're looking for. I think Duke's a nice blend of that along with clinical reasoning and things like that. So I think that can kind of circle back to that.
Yeah, okay. You now co-coordinate the Orthopedic Manual Physical Therapy Fellowship at Duke.
Yep.
That's like the player becoming the player coach. Like you now get to sit in the dugout and help call the shots. How's that transition from the person who is just learning into leadership change your perspective on things like mentorship and training the future physical therapists? Yeah, no,
I feel really fortunate for the opportunity. And, you know, right now, kind of like you talked about, helping out with some of the administration pieces of the fellowship and coordinating schedules. And we're going through our curriculum right now and kind of just taking a look at it and making sure it's comprehensive and cohesive and things like that. It's been a good transition. I've really enjoyed it. I think the opportunities that you have the opportunities I've had prior to this have prepared me well, and I've just enjoyed the experience. And it really is kind of similar to what I was doing before, but just a different position. In that ultimately the goal is to help patients, and through helping other fellows in training and facilitating our program and things like that, we're able to do that. But it has been kind of a unique opportunity. One of the things I think I'm most excited about is speaking out lifelong learning. I think being in a position, or, you know, anyone that's involved in residency and fellowship training, you almost have forced exposure to like continue learning through the different fellows. So it's really neat chatting. Even the fellow in training right now at Duke has gone through a different residency. He actually did a spine fellowship at USC prior to coming to Duke. So he's a wealth of information from just different angle that we haven't seen. So, you know, especially fellowship is a very two-way like learning street. You know, the fellow in training is obviously gaining a lot of insight, but we certainly have an opportunity to grow as a program too.
Right, but you gotta sit there and pretend like you've understood. Like absolutely,
that's exactly right.
I concur. Yep. What was the thing that surprised you most, flipping from student to mentor or leader? Is there anything that either surprised you or you didn't see coming?
I think there's quite a bit of coordination that goes into a program like that. You know, maybe I wasn't privy to before. I think this similar thing, I've had experiences in the classroom at Ohio State and Duke, and the same thing, just the emails and, you know, administration piece that you have to keep up on coordinating with people has been an eye-opening experience. But also, you know, seeing that done well is really helpful. That just makes that learning experience very smooth and valuable for the fellow. So
all the things that have to happen before the thing that everybody sees actually happens, and how that does that. Yeah. As somebody who's still relatively early in your career, right? You're gonna stick around for a while.
Yeah,
right?
Okay, good.
How have you navigated that transition to becoming that clinician mentor? You know, maybe with patients, has things, you know, changed? What advice maybe would also you give to other young professionals who are trying to find that path? You said maybe one of the things people should pay attention to before you start to look into residency or fellowship is understand what you're looking for. But how do you know what to look for before you start looking for it?
Yeah, right. I think one piece of advice that I was always given to is being comfortable with uncertainty or ambiguity in patient care, in your career, you know, what have you, whatever kind of situation. And I think that is a lesson that almost sinks in deeper levels as you kind of grow as a clinician and as a person.
Sure.
So, you know, towards the end of fellowship, there's some ambiguity of what next looks like, you know?
Right.
Oftentimes in the clinic, you know, multiple times a week, there's some ambiguity in what is going on with this patient.
Yeah.
And you're not exactly sure how to approach it and things like that. But I think that's part of the beauty in it. And I was listening to a podcast a while ago too, and I think it was with Dan Lorenz, who's more in the sports physical therapy world. But one of his advice to early career professionals was just increase your N, increase the number of patients you've seen. And I think there's just some patience that comes with that, and sitting in the uncomfortable ambiguity, discomfort type of deal, and you grow in that, and you get kind of incrementally better throughout your career and things like that. So I'm in the very early stages of that, but it's like a rewarding and frustrating and challenging and fun process all in the same.
I'm going to come to the defense of students for a second on that yuckiness, the ick, as the kids these days are talking about.
Yep.
And here's why. Because we go through first grade, second grade, third grade, we graduate high school, we go to college. College leads to PT school, college leads to PT school, then the boards. A lot of those have right answers.
Right.
Like, it's almost like now all of a sudden there's this jump where it's like now you need to be comfortable with open-ended answers and I don't knows and it depends. And that was hard for me, even though I came from a world previous of radio and communications. There it was sort of just, we'll figure it out. Hit record and we'll figure it out.
Right.
So I'm going to come to the defense just for a moment of students. It's like everything was sort of multiple choice and, planned out. And then all of a sudden you come to a point in your career where you have to then become comfortable with the uncertainty.
Right.
But I think that advice of increase your N is the only way to go. The problem is their N could be 0.
Yeah.
Until they get to a point in PT school.
Right.
And I understand why that jump is uncomfortable.
Right, exactly. And I think that's, I'll make a little plug for residency and fellowship training too. I think that's where that comes into help too, because you have someone who has 10, 15, 20 years of experience. Their N is much larger than yours.
Right.
But in the same sense, that 10-year clinician is also much less than a 30-year clinician. So I think that regardless of the stage of the mentor, that just being able to provide your experience and also saying that you don't have it all figured out too, and that their experiences and challenges with their patients, being able to pass that on to that learner who may have. I mean, I was just in that a couple of years ago in residency. You start this residency training and I've seen patients on clinical, but these are the first time I'm like managing patients, and the opportunity to just have someone speak some wisdom and snippets that they've seen throughout their career was invaluable. And even post fellowship training now, I'm considering what those relationships look like, because the difficult patients don't go away after fellowship. You still have those challenging cases and things like that you want to bounce it off people, but it's just not in your structured week to week. So I think that's, speaking about the lifelong learning, a really important component of that.
Yeah. Now, your areas of interest in clinical practice are spine and knee pain. Do I have that right? Right. Those are particular interests. How do you approach treating those conditions in terms of what are some of the key techniques or principles you've found to be most effective? Yeah.
Again, I think it's going back to the framework that fellowship helped me to kind of think through and develop, and things like the process.
To run through it, but also be okay with the ambiguity.
Exactly. Yep. So I think running through that process and realizing that there's ambiguity in that, but just kind of coming to what diagnosis or what treatment methods may be most effective for this patient. Even there's talk earlier this morning too, and it's a good reminder of taking into account what the patient values and thinks is helpful, because oftentimes that's what they'll do. And a lot of the research, when you kind of sum it up, it doesn't necessarily matter on a large scale which treatment you do. So I think that taking the patient's perception into it and what they value and what their thoughts are is really important too.
Questions like at the beginning of a plan of care, like how do you think this is, how would you like this to go? How do you think this will go?
Yep.
What do you think's wrong?
Right.
What do you think's going on?
What are your goals?
What are your goals? I'm just going to assume.
I'm amazed sometimes at what people say about what their thoughts of or what they want to get out of this, and that totally shifts how we spend our time and things like that.
I have seen, and I practiced for 3 years, me asking, because of course as a first-time clinician I was focused on the EMR, of course, right? I'm just doing the documentation. I was amazed at how many times me asking what are your goals would freeze people. And freeze people for me in my terms is like they don't know how to answer. They've never thought about it. So I like to ask framing questions like what can't you do now that you really want to do 3-6 months from now? What is the reason you're here today? What is that preventing you from doing? Because patients don't walk around with functional goals. I'm very sorry. They probably never said that F word in the last year. That's our word. So asking those things can be terribly important, I imagine.
No, I really think so. And it's funny when you just sit down and listen to folks. I think it especially helps with thinking about when physical therapy is over too, like discharge. there's an interesting article that asks patients whether they would feel better, or if they would prefer to feel better or feel good.
So say that one more time. If they prefer to be better or good, that's interesting.
Yeah.
Okay.
So I think we're like looking for like, oh, do you feel like a little bit better today? You know, when and the study kind of talked about that doesn't matter to patients as much as feeling like good or that their problem is resolved. So I kind of like that, to ask that question as well sometimes to folks of how things are going. But I think just leaning into that and getting to know the person and really. I think healthcare is such an individual experience and what folks bring into it. So really connecting with them on that is important.
Very much so. Let's talk about future things.
Yeah.
I mean, a lot of change for you going from student and now to leader. What are your goals? Now I'll just put the question on you. What are your goals as a clinician, leadership and fellowship education? Any specific areas that you'd like to go towards?
Yeah, I'm really enjoying the where I'm at now.
Good.
I think it's
a lot of times in our society it's what's next.
That's right.
Let's get promoted. But that's a great answer.
Which I think are definitely good things to think about and things that I'm considering. Really just excited at the opportunity to help with the fellowship at Duke and grow that program and see opportunities that are there. I also help in the PT program at Duke, kind of depending on the season, their musculoskeletal and manual therapy curriculum. So I'm really enjoying that. I've been in and out of research in different times of my career in residency at OSU. I had the opportunity to work with some researchers there, and would look forward to kind of continuing that here at Duke in the next year or two, kind of getting involved in some projects and things like that. But just excited now for the opportunity to grow in this kind of new stage and new roles and post fellowship and all of the training and stuff, and just kind of figure out what that looks like and go from there.
I love the line that, the you right now, where you are right now is the 5 year ago you were dying to be here.
That's right. Exactly.
Maybe don't rush away from that.
Exactly.
Just yet. So I'm glad to hear that. Last thing we do here on hands-on, hands-off is like sort of a parting shot. Mm-hmm. What would you want to leave with the audience as we wrap up? Any idea, concept, quote, anything?
Yeah.
Words of wisdom? As an educator, you always have to have that soapbox.
I do.
Right?
I do.
What's yours?
I think the most important thing is exactly what we've talked about, in that growth is not, or your achievement is not like a one-time thing. And I think it's like something that happens slowly throughout your career. And I've realized that you think, once I finish this, I'll be this, or
then
once
I
get this project, or if this gets accepted, then I'll be there. But that's really not what it's about at all. It's just kind of each thing incrementally kind of bringing it closer and closer to the kind of the best version of you, if you will. And I think there's a patience that comes along with that, which is sometimes hard, and staying present in the journey is important. But it's one thing to say that, and it's one thing to believe that and sink into that.
Theory and practice, right?
That's
bringing
exactly
that into practice. Yeah. I heard a great line when asking kids, instead of, because we were all asked, what do you want to be when you grow up? And it goes along to how you just framed that, which is, instead of asking, what do you want to be when you grow up, what kind of person would you like to be? What kind of person do you hope to become?
I like that.
And it makes them think, it makes me think of things differently.
Yep.
And I think that's a better question, and we get better answers, and we get better thoughts out of that.
I liked it.
Cody, appreciate you taking time out of your first AOP.
Let's go. Yeah.
Appreciate that. Thanks,
Excited.
man.
Yeah, I appreciate it. Thank you.